Now, I want to introduce Alex. Him and his dad want to run one of the coolest clinics ever. If you've ever had mercury fillings, okay, and been afraid to remove them because you're deadly afraid of the dentist, okay, I'm the only one. Okay, it's not the advancements down there. You go down there, you get a vitamin C IV during the procedure, so you're not going to end up with any toxicities. And then they pick you up on one side of the board and drive you across. I'm riding with a gal from Australia, one from, close to Belgium.
Belgium,
And we're driving across the border, and they're doing anti-cancer therapies at this clinic. And I'm going, this ain't the standard dentist. So he's going to talk about the importance and what they do. So, thank you, man. You're right.
Thank you. So, unlike the other speakers so far, I am not a professional speaker. In fact, this is going to be my first time speaking for something like this.
Yeah, welcome.
So, thank you. So, go easy on me. First of all, are there any dentists here? No? Perfect. Me either. So we can talk about them. My dad's had the dental clinic there, and actually this is my dad, Alessandro. Stand up. If I gotta stand up, you gotta stand up. He's Alessandro Porcello Senior. I'm Junior. Hopefully no one mixes that up, or I'm gonna be very insulted. But he's had the American Biodental is the name of the clinic. We've been there for 16 years. I basically grew up there, so even though not being a dentist, I've been involved in one way or another. I've gone to the Huggins training, which I'll explain a little bit more in a little bit. And of course, well, just from being there, talking to the patients. And I've been there full time for almost 4 years now, ever since I finished college. So, a little bit about the clinic. We are a holistic clinic, which means we don't use metals. Our first priority is your health. It's health, and then it's, cosmetics and everything. Obviously that goes into it, but what we're going for is what's best for your health overall, not just your mouth. And it will surprise you how big of an effect what's in your mouth has on the rest of the body. And the first thing I will talk about is the mercury amalgams. That is one of our specialties. There are 4 things that are the biggest on the health that I will kind of talk about, but that being one of the biggest and most popular. And like the other 2 subjects today, sex is money. No one really likes talking about dental. You go, no one does. Yeah. So one of the things is, well, I'll get to all that. One of the things is that you go to your medical doctor and you say, oh, I have this problem. They never tell you, well, what's in your mouth? They never check to see all of that. They always just give you your pill or, give you, let's try this and we'll see how you feel after a few weeks. But the different things I will be talking about, and I do apologize, someone helped us out with the PowerPoint, and when we brought it, we just realized there's a few slides missing, so we'll have to improv some of it. But the safe silver or mercury filling, how we do the removals, because it's very important how you remove it. We've had patients that come in and tell us I was perfectly healthy until I read up about mercury and I wanted it removed. So I went to my dentist, who was just regular Joe dentist, and I asked him to remove it. And that's when my health issues started. The biocompatible dental materials, cavitations, one of the most overlooked things in dentistry. Cosmetic biodentistry we'll talk a little bit about. Heavy metal detox and inlays and onlays. I think I'm not missing. Oh, the hair test, which goes with the heavy metal detox. And environmentally friendly office. Amalgams. So what an amalgam is, it's an alloy of combination of different metals. Before, the big thing were just mercury amalgams. Obviously, that people started realizing, well, that's it's not too good. Mercury's been used for thousands of years to kill people. So let's make them silver fillings. Ironically, silver fillings are still basically mercury fillings. They changed the combination a bit, but it's still 40 to 60% mercury. The other is silver, tin, copper, zinc. That can change a little bit depending on what they're doing. Ironically, also, the near mercury fillings are more toxic than the older ones because of they put a little bit less mercury, but they put other things that make the mercury more toxic. So even though it's less mercury, the mercury in there is a lot more toxic. Yes?
When did they start the newer process?
Was it 20-ish?
About 20,
Yeah, like in the 90s.
25.
Yeah, 20, 25 years is when they started changing them. Right now, the ADA, which don't trust in the ADA too much that they're doing the best for you, the patent for mercury is not owned by the ADA. It's owned by another organization whose office is directly in front of the ADA and whose most of their board are ADA members. It's kind of a loophole. There's actually an interesting, before I get into all this, little history. Does anyone really kind of know the history of the dentist? No? So, to not make a long story, to make a long story short, there you go. Basically, before there was the official kind of profession of dentist, there were kind of two groups that started doing it. There were the medical doctors, the physicians, who were doing dental. And then there were the barbers, who would cut your hair and pull out teeth. Yeah. So what ended up happening? As they became more popular and, dental started kind of, I guess, becoming its own field, there was kind of like a little turf war between the two. There were the physician dentist and the barber dentist. The physician dentist, at the time, still, they're the ones you wanted to go with because they were still kind of taking into account your health. The barber dentist, not so much. You go, get a haircut, boom, pull out a tooth, probably with almost the same tools. There you go, off you go. So it ended with the barber dentist kind of being just a bigger majority. And they got together and they formed an organization, which was kind of the predecessor of the ADA. So the barber dentists are the predecessors of the modern ADA and dentists. And the physician dentists kind of got pushed off to the side until they, just disappeared. So that's the legacy of dental, at least in the US. But to get back on the amalgams, the toxic, besides the mercury and the other metals, what's going on is mercury is the only metal in that at room temperature is a liquid. It's why it has to be combined with different things to make it solid. However, it's basically like having a battery, in your mouth. It's a conductor. It's causing all these electrical problems in you can say. Besides the fact that things like hot, even cold, chewing, your bite is stronger than most people realize, and you're constantly biting and chewing. You drink coffee, it's hot. All of that's causing a little bit of the mercury to break off and for you to swallow. Now, I saw a video of this guy who was a Russian shaman, and he opens this big thing and he has mercury there, and he basically grabbed a cup full of it and he drank it, and I guess that's what he was using for to heal people. And someone put in the comments, oh, but it's fine to drink mercury because your body can't absorb it. And you look at the guy, and the guy's shaking and just looks completely sick. It does, there's a reason why they tell you not to play with, you break the little thermostat and you don't play with the mercury. It goes through the skin. But besides you just swallowing that mercury, what the mercury is doing, it's affecting your neurological system, it's affecting the gastrointestinal system. You're getting poisoned. One mercury molecule kills one cell. The problem is the cell dies, the mercury molecule doesn't, so it keeps going. And the mercury can actually change states inside of your body. There's a type of mercury that can cross the blood-brain barrier. And if it essentially rusts while it's in there, it can't get back out. So what ends up happening, a lot of people have things like neurological disorders, Parkinson's, things like that, and you check their mercury levels and they're off the charts. The other toxic or big problem with the mercury is the vapor. Mercury releases vapor. There are videos you can look up on YouTube of, I believe it's a graphene sheet that you put, and you put a little mercury amalgam that was just taken out of the mouth. And you put it behind it, and you flash like a UV light, I don't remember what type of light, but you flash the light, and you can see the vapor coming off. We've had patients tell us the reason they came with us is because they were at a conference. And this one guy specifically, he said he was at a conference, some guy was talking, and he noticed that the patient had metals, all these silver fillings in the mouth. So what he did was he went and he grabbed this little machine and he just had the guy talk to him, standing right here in front. And he put the little machine in front and the machine went off. It's a detector for mercury. So all of that you're breathing in 24/7, plus it's now to the point where you are your significant other, your husband, your wife, you kiss them, you talk to them. You're breathing that mercury into them. You're in a room full of people. You're releasing that vapor out. So what we do with the mercury amalgams, we follow the Huggins protocol. Dr. Huggins passed away about a year and a half ago, 2 years ago. In, I believe it was the 70s, he was a dentist practicing in Colorado, and he realized he started developing problems. So he started looking into it. And he realized, he came to a conclusion that it was from the mercury. Well, he did some studies, went and told people, got a license revoked by the ADA for talking about it. So he essentially just devoted the rest of his life to research. The way we remove mercury in our clinic with the protocol, you remove it, you drill it a certain way so it doesn't heat up too much, that doesn't release more vapor. When you're removing it, you have the vitamin C, like Dr. Bergman said. What the vitamin C does, it's in this case, it helps with your body's ability to chelate some of the mercury out. We also put, it's called a rubber dam, it's a plastic covering that goes in the mouth, and you only have those teeth that are being worked on exposed. That way it catches all the water and the runoff. We have ionizers, we have a basically vacuum for the air, so it picks up all the vapor. There's a certain way you want to do it. You don't just go in and drill it out. If you do, that's when you end up swallowing chunks of mercury and having problems. The materials we replace them with, a lot of the white composites, resins, a lot of them, I believe it's like 90% of them are actually not safe. Just because something looks like your tooth doesn't mean it's safe. A lot of them do contain either BPA plastics or aluminum and nickel. It's why a lot of people that we see say, oh, I went to a biological dentist and they changed all my fillings. I have no more metal in my mouth. And when you look at their x-ray lights up like a Christmas tree. And it's the composites. They have a lot of aluminum. And aluminum is, after mercury, the second worst metal you can put in the mouth. And aluminum is very, very common. The other, well, kind of got a little bit too there, but the biocompatible materials, a lot of things that are being used are, for example, they're using metal porcelain crowns. A lot of people don't even realize they have metal porcelain crowns. They think, oh, I have all the metal out. And then you actually show them. It's a metal core and it's covered in porcelain. It's the most popular kind of crown used, and actually a lot of times we find a little bit of mercury underneath. It's easy to mold, so the dentist uses it as a buildup to attach the metal core onto. So I thought it was going to be a lot quicker, and apparently I'm going slow. Well, this is where one of the slides is missing. So before I get to cavitations, root canals. Root canals are the other big thing that we do. Well, we don't do, we take them out. What a root canal is, it's a dead tooth. whether it's a holistic root canal, a normal root canal. The process of the root canal is they drill into the tooth, they sever the blood and the nerve vessels in there, and then they pack it in with the material and usually put a crown on top of it, and that's it. Why do a lot of people, well, a lot of people don't know they even have root canals, but a lot of times people don't want to lose a tooth, so they just do the root canal. But we've had cases of, just a few weeks ago, we had a lady who came in and said, they want to do a root canal on this tooth. And we looked at it. There's nothing wrong with the tooth. No cavities, no decay, nothing. The only thing she had, her gum line receded a little bit, so the root was exposed, so she had sensitivity. And in the US, they said, nope, we're going to do a root canal. So they're going to kill a tooth just because her gum was a little low. What ends up happening, to explain, is like any living thing, plant, animal, human, you kill something, it decays. And then it doesn't help that with the root canals, they also put a toxic material in there, which has some metal. So the root canal, as it decays, it starts producing bacteria, and worse yet, that bacteria in there that kind of festers produces toxins, and that's what crosses into a bloodstream and you swallow. And we see a lot of patients that have cancer. We work with cancer clinics down in Tijuana, and they send us their patients to have the metals and the root canals removed, along with cavitations and implants, which I'll explain briefly right now. And you see the big change. We had a patient that the first time she came in, she was in a wheelchair. And by just removing the infected root canals and the metals, 4 months later, she came in walking with a cane. It takes a big toll on your body. Cavitations is something similar. What a cavitation is, and it explains it more in the information that we gave you, essentially when you lose a tooth, whether it's pulled out or falls out or anything like that, what ends up happening is the bone, if you don't properly clean out either the ligament or the infection, you get basically a pocket of dead bone over time. The reason with the ligament is your body thinks that there's still something there. So when it starts healing, it thinks there's still something there, kind of confuses it, and by the time it kind of heals around and absorbs the ligament, you have that pocket. With infections, the common thing is you just kind of clean it out. If there's pus and things like that, you clean that out, but you don't remove all the dead tissue. And they just give you antibiotics. That's where the problem lies. All that dead tissue kind of remains, and that's where it'll keep growing, and if you have other health issues, it'll grow faster. So what we do for cavitations, we go in, we remove it, all the dead tissue until it's only healthy tissue, clean it, and then we put ozone to sanitize the area, kill the remaining bacteria, and we put your own plasma. So whenever we do extractions and whenever we do any kind of surgery like that, we draw a little bit of blood, separate the plasma from the red blood cells, and we put your plasma back in there before we stitch it up. Your body reabsorbs it and it regrows the bone and the tissue not only a lot faster, but a lot better with less pain and less swelling. So a cavitation, to kind of speed this up a little, looks like that. This is a jawbone that got sliced in half. This black area is the dead bone. So when they do a cavitation, and a lot of our dentists, even when they start, don't believe it because they don't teach you this in school. They have to see one of our older dentists show them or have them actually do one. And what they do is they basically scrape out mushy dead bone. Yeah. Go. So cosmetic, I will kind of jump through a little because we did one on the bridges. Tell you the truth, we prefer not to do a permanent bridge unless you already have the teeth prepared for it, because otherwise you're damaging healthy teeth. You got to shade down the teeth on the sides. If you already have crowns, doesn't make much of a difference. We prefer what to do there is do removable partials, completely metal free. They just grab onto your existing structures and to the bone underneath. The only things you have to take them off, but you eat, chew, bite down on them, everything, talk with them. It's just that, when you brush your teeth, it takes 10 seconds more and you take them off, you clean them. Again, no metal. And this is another big thing. A lot of people probably haven't even heard of an inlay or an onlay. An inlay and onlay is, say you have an amalgam like this. So when it gets big, a lot of dentists, what they do, they shave down the tooth and put a crown. What we do is called an inlay or an onlay if it gets a little bit bigger. Essentially, our philosophy is try to preserve as much of your healthy tooth as possible. The moment you shave something off the tooth, you can never unshave it. The damage is done. So a lot of dentists don't do inlays and onlays. In fact, a lot of our dentists, when they first started out, some of them haven't done inlays and onlays since they were taught that in school, or they did 1 or 2 a year. The reason being is it takes more time. You have to remove what's in there, clean it out with, for example, mercury. The mercury is so toxic, it actually kind of kills the surrounding part of the tooth that it touches. So you have to remove that dead part of the tooth, clean it, and at the same time you have to prepare it to where you can place this inlay without it fracturing. The inlay gets made in the lab. In the US, and again, we've seen for one little cavity, a crown, that didn't even need an inlay. But in the US, once dental insurance became popular, the number of crowns skyrocketed. Crazy. So, and crowns are easier or quicker to make. You shave down the tooth and you put a crown. One inlay takes more time. Even our technicians aren't used to making a lot of inlays until they start working with us. So with doing an inlay and onlay, obviously sometimes you do need to do, I didn't put that one up. Sometimes you do need to do crowns. There's no way around it if the tooth is just too damaged or you already had a crown. But if you have the option, or if it's possible, an inlay or an onlay will preserve more of your natural tooth. And the last, since I didn't really get too much into the medical, I'm about to finish. But what we do at our clinic, we combine a little bit of the medical field with the dental. But in not just traditional, medical. We do vitamin C's, we do different types of vitamins. We do stem cells, we combine ozone with a lot of treatments. Another thing that we combine is a hair test. So a lot of our patients do a hair analysis. Once all the metals and the root canals and all that's removed, the hair analysis will give us a metal toxicity in the body. A lot of times it's from the mouth, sometimes it's environmental. Some people work in certain things. If you're a plumber, you're going to be exposed to lead and a whole bunch of other chemicals. So this gives us kind of a guide. And from there, once the dental is done, what we recommend is get checked out, see what's also toxic in your body, see what types of chelations you can do. And if you already have some other issues, then see what are the other options. Get more of a full picture, more of a full treatment instead of just a cavity here and a cavity there.
So here we are with Alessandro Purcell, and when you look at his clinic, American Biodental, it's so far beyond a dentist. And this is the second cruise he's been on, and the information is always cutting edge at how not just dental health equates with health, but how disease reversal, what they're doing at their clinic is beyond compare. That's why a lot of their therapies are in Mexico and not in America, because it's illegal in America. Now, what do you want people to take away from what you were talking about?
The biggest thing is just to be aware of how much everything in your mouth affects the rest of your body. A lot of diseases either start off or are made worse by what you have in the mouth. The things that dentists are commonly using, besides the mercury, the common sense thing of mercury and leaving dead teeth in there, infections. There's also realized that even the things that seem safe, the white composites, the resins, some of those aren't. So it's just for them to become more aware of that, to not just go off what your dentist says, to do a little bit of research, find what you're compatible with and what you're not compatible with.
I was amazed when I went to your clinic. You literally have patients from all around the world.
Yeah.
And I thought it was a dentist, and they're doing ozone therapy, they're doing live blood cell analysis, dark field microscopy. I mean, so many different procedures that were equating the toxicity of the dental thing with actual real health. Now, what about some of the IVs that you guys do?
So at the clinic, the big thing is that yes, we are a holistic dental clinic. However, we also incorporate medical doctors. We work with chiropractors. We work with chemists, with physical therapists. We work with a wide variety of people, and we do a lot of that in our own clinic. The more common things that we do are IVs, so vitamin C, we do vitamin Bs, kind of cocktails of different vitamins. We do analysis to see what you're deficient in. We have specialists that can come in, everything from nutritionalists to different types of doctors. So that way, not only are you getting, the dental removed, well, not the whole dental, but the mercury and the root canals removed, but after that, you're getting after treatment of, okay, now that I got the mercury out of my mouth, how do I detox the mercury that's been built up in my system over the years? And of course, we offer other services for health issues. We do stem cells, different types of treatments. But we try to do a complete picture of your health instead of just focusing on one thing and then good luck once you get out of there. We're trying to have you optimal in all the fields.
And I love the brilliance, because a lot of people are afraid to go to a different country, but all you need is a passport. They will pick you up on the American side of the border and drive you across if you have that phobia of traveling to a different country. There's a hotel right next door, the 3-star or 4-star hotel?
4-star hotel.
4-star.
We're located technically inside the hotel. One of the major landmarks of the city. Everyone there speaks English, and they're used to dealing with Americans and international. Our staff too, just about everyone speaks English. We make sure comfort and is a big part of the experience too, because not only are you leaving that, for a lot of people it's the first time leaving the country. So we want to make sure everything from being picked up at the airport or at the border to being crossed over to the clinic, your stay there. Even around, the restaurants, there's an organic restaurant right across the street. So we try to provide you with as much information, as much comfort while you're there. And then when you're done, we take you back across, and that way you're comfortable while you're getting healthy.
Beautiful. Now, how can people get in touch with you?
Right now, the easiest way is our website, AmericanBioDental.com. Our email is just info@AmericanBioDental.com. We have a website for the medical, which is AmericanHolisticCare.com. We're in the process of redoing the website, so it's going to connect the two a little bit better. The dental one we've had for a while, the medical one's a little bit newer, so we're redoing it to connect everything and make it a lot easier to have that communication between us and between the patients.
I got to tell you, the best quality work you're ever going to get in anywhere around the world. And plus, they're just really cool. Buddy, this is the second cruise we've done together.
Yeah.
We got to keep doing it, because I just like you. You're cool.
Thank you. It's been an honor, and it's been an honor to be here.
Thanks. I mean, really good. I mean, your dad's going to be so proud of you, because, he's cool, and you're cool and classy. It's pretty neat.